I'm Candace Stuart. I'm the Director of Communications at CHIME, and I have a very special guest with me today. I have Anika Gardenhire, and Anika is the Assistant Vice President of Digital Transformation at Intermountain Healthcare. And so, Anika, I believe it's about your 1-year anniversary in this position. Is that correct?
I think that's true. I've been at Intermountain for about 5 years total, but yes, it's just a little over a year that I've been in this role.
So tell us a little bit about what you do in this role.
Oh, that's such a great question, and I think digital transformation is different a little bit of everywhere. But in this role, I have responsibility for a multitude of areas, including data governance and emerging technology and enterprise architecture, and a few others. But I think more than anything, my role as a leader of this space is to help support the organization in doing things like creating a digital transformation roadmap and preparing for the future. And so I get the very fun responsibility of serving on our Intelligence Automation Committee, and I serve on as a co-chair of our Enterprise Information Council. And so that's how some of these things wrap up. So I'd say that's probably what I do more of than anything, is helping to make sure that we're defining digital transformation and supporting and building the relationships with leaders who really need to implement these technologies to transform portions of their business.
So what have you seen that's changed in the past year from when you began to where you are now?
I think the big thing that's changed in the past year is just a bit more clarity. I think coming into the role, it was exactly that. I don't know that we were completely clear on the work that we had to do. So I think we painted a significant amount of clarity. I'd also say that from an industry perspective, the work around digital transformation has been somewhat more defined. The World Economic Forum came out in the last year with some really clear definitions of digital transformation and the digital work ahead. We are preparing clinicians for Year of the Digital Nurse. We've seen large industry shaping statements from Google and Microsoft and clearer positioning there as well. And so I think that I would say that the last year has been a bit of a whirlwind, but we've come away, at least for all of the areas in digital transformation at Intermountain, with clear milestone plans for every area of our organization. I feel like we have our feet up under us a little bit more holistically around strategy, and we have clarity of partnership across the organization. I think those have been some really clear milestones for us. But I think the other part would just be measurable and clear objectives. So we have clear metrics that we've set for ourselves that are going to give us a way to measure ourselves and understand whether or not we're winning and doing the things that we've said that we want to do. So one of the things that I came into this role really wanting to do is to be clear about how would we know when we've transformed something, right? When we're out of transforming and we've actually done it. And so a big part of this initial year was making sure that I had clarity on when we would know. And I think we have a bit more of that now.
Oh, that's really interesting. So when you're looking at the different solutions that you might have and the different technologies, are you looking at totally new technologies and solutions, or are you looking at new ways of using your existing tools, or perhaps both?
I think it's both. We're definitely looking at new ways of using technologies that have already been there. I think about things like sentiment. Sentiment technology has actually been around for a really long time, but I think as a part of digital transformation and really wanting to understand sort of people's connection to technology and feedback, that we're using sentiment and sentiment analysis in new and interesting ways in order to be able to measure things like that. And then there's brand new technology as we think about cloud, as we think about new opportunities around interoperability and what API structures will look like in the future, and really developing the technological strategies that will allow us to move ahead as we look at 5G and the implications of 5G and the Internet of Medical Things and connecting devices. I think we're finding that there are really new ways, new technologies that we're applying, but then again, you know, it's still one network, it's still one infrastructure, and so we have to make sure that we're thinking about new ways of using technologies that have historically been really stable for us as well.
Mm-hmm. Yeah. And then, you know, previously you and I had talked about something that I think is close to your heart. You were talking about calm technology. And
Yes.
I'd like to revisit that a little bit. Could you explain what it is and then how, you know, an example of how that's been implemented?
Absolutely. So calm technology is really kind of a movement. It's a set of books. And it really talks about the general premise that if technology has meant to be a conveniencer, right? If it's meant to be something that helps to convenience us as humans to make life better, then why sort of in this new industrial age are people feeling more stressed and more under pressure? And so the general premise of calm technology is to create technologies purposefully that convenience humans and that work in the background. And as you know, we've talked about, my background is as a clinician. And so as a clinician and working in health information technology, I am a huge proponent of not interrupting empathetic moments with technology. I want to be able to enhance and support and maybe even create more concentrated empathetic moments in the high touch environment that is healthcare. And so how do we think about implementing technologies purposefully in a way that they function in the background while still conveniencing clinicians? And so one of the things that we've done that's actually pretty foundational, but it'll give us the ability to have more agility in the future, is that we're being purposeful about how we're looking at alerts, right? We hear people talk about alert fatigue, and by nature of alerts being what they are interrupters, right? Because in order to alert you, I need to interrupt you on your path. And so one of the things that we're looking at is how do we create ways to divert or to nudge the human in the right area or direct traffic without there being as much of an interruption, so that we think about cognitive load, so that we think about reduction of interruptive alerts. And so we formed an actual team specifically called Decision Support Effectiveness that is focused just on looking at how we do that, and also on reducing alerts that are no longer necessary. So when I get to a place that 80% of the time an alert fires, people are moving through it, I probably shouldn't be firing that anymore. And we don't always have that group whose job it is to say when we should turn something off. We in technology are really good at groups that say when we should turn something on. And so we're trying to be really purposeful about thinking about when we should turn something off, or when we should think about a different mechanism that purposefully reduces cognitive load and operates in the background so that it's not interruptive. And so that's one of the things that we've done so far that's really driven by sort of that calm technology thought process of saying, how do we become less interruptive with the technology?
Oh, that's really cool. And you used a phrase that's really interesting to me as well when you talk about high touch. And I'm
Yes.
wondering, when we talk about high touch and technology, particularly as we get more virtual care, how do we do that? How do we maintain or even have high touch when it's virtual?
You know, honestly, I think that there are ways to do that. I mean, I find for myself, and that might be because I have a little bit of a technology affinity, I find that I feel like I can form really great human connections through technology. And so when I think about high touch, I mean that empathetic connection as well, which might actually be facilitated through a digital platform. And so I think that people are finding now through social media and other areas that people do form really super solid social attachment through the enablement of digital platforms. And I think that telehealth is going to help us do that. But I do think that it's going to require us to have a bit of specific training and a bit of specific knowledge around how to do it, right? And so I think to myself, how do you create purposeful connection over a digital platform? What level of interruption reduction do you have to have? What level of sort of facial expression and what type of communication style is really required to make that feel like a solid connection between two humans? And so I think we're finding more and more research actually in that space specifically that I think is really going to be important for how we think about the next level of transformation in virtual care. And then there's the piece around supporting virtual care with the people who actually show up in person, right? Because the reality is there are some skills from a healthcare delivery perspective that still have to happen in person. And so I think figuring out ways to have continuity between the virtual care environment and the person who shows up is another way that's going to allow that virtual interaction to extend into something that people feel connected to. And so if I show up at your door and you've had 3 physicians visits with a provider that have been virtual, if I have some understanding of those virtual visits and can continue the conversation in a way that feels uninterrupted, it's probably going to allow a deeper connection there. And in fairness, I think we have work in that space, but I think we definitely can do it.
So what do you envision a year from now? So you've had 1 year in the position and then a year from now.
I think they're going to be, it's probably sort of a 3-pronged plan in my approach, and I like plans. I think they're really important. And so, one thing that I would say is I want to make sure that we're building on a super solid technology foundation, right? And by that, I mean that we have the infrastructure that we need to make the more agile and the newer technologies really sing. And so I think about the foundation of network and data centers and all of those things being really fundamental to what we build the rest of our technology strategy on. And so I think the next year will be about ensuring that those things are shored up to a place that makes sense for us. I think from an organizational perspective, Intermountain is really focused on business model transformation. And I see digital transformation having a really solid role in supporting the business in transforming those business models. As we think about social determinants of health and those types of things, having to making sure that we have the partnership required to support the organization in that is really important. And so I'm actually serving on a digital health committee for the state that's really looking at how do we build state infrastructure in order to make sure that we're supportive from a technology perspective. And then I think the last thing is just making sure that we have a long-term talent plan. As we think about the true digital transformation is an organizational human-centric change, right? The technology that we have to support and enable digital transformation, a lot of that exists, right? But we have to help humans through the changes that are going to be enabled by these technologies. And so for me, the next year will be about making sure that we have and supporting and partnering across the organization to ensure that we've developed the partnerships to help all of our caregivers through the next level of changes. And that includes our talent plans, both from a technology perspective as well as from an organizational perspective. And so I think that'll be a bit more of our focus. And of course, I expect to see really cool new startups in the market that we want to pilot. And I want to make sure that we have an organizational technology stack that allows us to develop more of that plug and play capability so that we can rapidly pilot and understand how we want to partner.
So one question I have is, Intermountain is really a leader, a digital leader, and is well known, and I think fairly well resourced for a number of things. So for other healthcare organizations that maybe don't have the pool that you have, the resources that you have, do you think what you're doing can actually translate to what they're doing?
You know, I definitely think so. You know, one of the things that's important for Intermountain Healthcare is that we are a model, and we want to do that. And so we want to be able to enable other organizations to move forward with us, absolutely. But I also think, you know, even for organizations that might be more resource constrained than Intermountain Healthcare, one of the things that I would say, even as Intermountain, that we found is that we still have to have focus, right? And we have to make sure that we are clear on the things that we're saying yes to, but we need to be really clear on the things that we're saying no to, right? And so, irrespective of the level of resourcing that you have, that might look different for you, but there are probably going to be things that for those that have different levels of resources that they can definitely say yes to. And
Mm-hmm.
those might look different depending on your organizational strategies and where you see yourself moving forward in the market. But I think it's a matter of finding those things within the resource containment that you have, and then being able to push out a little bit of the noise that might be keeping you from getting there. And I think that's probably true in every organization, is that we have work to do to figure those types of things out.
Well, that's great. So we appreciate your taking some time with us. Is there anything that you want to add before we wrap up?
You know, the only thing that I would probably add from a digital transformation and a digital health holistic perspective is, you know, I think that technology has such an important role in the future of healthcare. And I want us as healthcare leaders, right? So, irrespective of the background, us as healthcare leaders, to be really thoughtful about the impact on care that technology can have. And so one of the things that I would love to partner on and to really think about is, how are those of us as healthcare and healthcare technology leaders thinking about health literacy and digital literacy for populations?
Mm-hmm.
The ultimate customer is the consumer and is the patient, of course. And so how we're able to educate them to take advantage of technology, be it digital platforms or devices that we're sending to people's houses, is going to require a certain level of digital literacy and can definitely play into health equity. And so as we start to think about this as a collective community, I'm super interested in how we as leaders come together to really support populations and patients in having an appropriate level of health and digital literacy for the future.
Well, thank you. And also, thanks for wearing that chime shirt.
I didn't even plan that, by the way.
Well, unfortunately, you know, with audio, they're not going to be able to see it, but they're going to know about it now.
I love it.
Thank you so much, Candace.
Bye-bye.